My name is Marvin Dewick, and I'm a pastor of the Pentecostal Church in the community right now.
My name is Mrs. Shaw, and I'm a teacher at Grimshaw Junior Senior High School.
My name is Lawrence Arnold. I'm the fire chief for the town of Grimshaw.
My name is Leslie Harrison, and I teach health and phys ed at Grimshaw High.
My name's Hillary Mollis, and I run Community Adult Learning for the Grimshaw, Berwyn, and District area.
Paul Quigley, Vice Principal at Grimshaw High.
My name is Tara Elliott, and I'm a public health nurse for Alberta Health Services, so I work here in the hospital. So I think the first thing we need to think about addiction is it's a disease. I think that would reduce a lot of the stigma attached to it. To me, addiction is if someone else tells you that's an issue, that there's an issue with your drinking or your drug use, that's how an addiction would be defined. Because people who are addicts, they don't think they have a problem, so it's the people around them that need to realize that they have a problem and tell them that.
I think having an addiction is being part of something that's out of your control, and no matter how much you want to change, sometimes you can't do it on your own.
An addiction is an often repeated behavior a person uses to either distract or cover over an unpleasant feeling. It's kind of the go-to action of choice by the individual when the person is feeling afraid, anxious, bored, insecure, angry, threatened, intimidated, stupid, embarrassed, those kinds of feelings. Because the behavior or action is just a distraction or a cover-up, it never faces and resolves the issue related to what made them feel that way to begin with. In essence, it's an avoidance of dealing with real-life issues head-on.
The way I define it with the students that I talk to is an addiction is anything that you must have, that you just can't do without. Doesn't matter what you have to give up to get it.
Yeah, most people will tell you the common addictions that we're most familiar with, things like smoking, drinking, alcohol, using drugs, pornography, etc. And those are absolutely right, because those things are used to distract or cover up unpleasant feelings. Whether a person admits it or not, doesn't change the fact that they are not resolving the real issues that those things are being used to cover up.
I was about 20 when I met him, and we did it for a while, and I left shortly after, maybe 4 months into the relationship, because he drank too much. Then 4 years later, we got back together again, and everything was going well, and we were engaged, and he was dry and sober, attempting to be, and he went back to the alcohol, and it ended our relationship.
Well, both of my grandparents are addicted to cigarettes, and it's actually been a positive thing in my life because I know if I were to even touch one, both of them would kick my butt because they know that it's not healthy for them, but they're already addicted. So I didn't get addicted because I was scared of them, so it was lucky for me.
Personal level, it made my childhood a little interesting. I had a mother who had an alcohol addiction. Professionally, I deal with it pretty well daily. Every call we get, there's a pretty good chance.
I remember my first class. I was a really smart student in my class who was bright as could be, and he was drinking quite a bit, and I found out later that his whole life came apart because he became a full-fledged alcoholic at a very young age.
There's lots of health risks associated with addictions. Firstly, it's based on what you're addicted to, whether it's alcohol, smoking, drugs. Also, along with addiction, there goes with a lot of depression and mental health issues. You can get into high blood pressure problems, lots of cardiac problems with certain drugs that you can use. It can cause lots of long-term problems with your liver and kidneys. So it's very serious health problems that you can get from having an addiction.
I'm fairly familiar with a lot of the different health risks because of the job that I do. The health risks can be anywhere from physical risks to mental risks, social. People lose their whole lives because of addictions.
I'm aware of them. It depends on the type of addiction. Addiction to drugs leads to all sorts of physical complications, to the point of death or severe physical damage to the body and the brain. To alcohol, long-term effects are to the liver and to other organs, and short-term in an alcohol overdose situation is once again death.
Well, because of the wide range of addictions, there's also a wide range of risks that are direct results of making these behaviors into habits. For example, the more you use tobacco, the greater your chance of getting tobacco-related cancers is. That's pretty obvious. But have you ever considered what else you could do with all the money spent on tobacco or alcohol or drugs? And what about the time spent to make those drug deals? What else could you do with all that time lost that would be way more productive? One common symptom of that innocent drug, marijuana, that people want legalized, is that it can make you impotent, unable to sexually produce new life.
Absolutely. I have been a foster parent for 14 years. I have seen many youth come and go either through my kids or through the kids that my children hang out with who have struggled and continue to struggle with addiction issues.
We have a significant population in this town that uses alcohol as a crutch, or however you want to put it. We also have a significant amount of soft drugs and hard drugs being used in the community.
I think one of the biggest problems facing the youth right now is the disconnect from reality that we see with the iPhones, instant messaging, Facebook, the anonymity on those sites and the discussion of drugs and alcohol use and escapism can be misrepresented easily, but reaches such a large audience and has a degree of unrealistic expectations to what they're asking. If you go on YouTube, there's a lot of drug use and a lot of partying that's portrayed as a lot of fun. What they're not seeing is the trips to the hospital for the pumping out of the stomach, or the alcohol overdose, or the drug overdose, or the graveside service for the person who didn't make it back, or the accidental suicides, and just plain accidents that end up harming these youth who are trying to escape. If we just put down our electronics and started talking to each other and connecting one-on-one and realizing that everybody's suffering the same, and nobody has the answer, nobody knows what they want to be in life. It's just, you have to make decisions on what you don't want in life. And if what you don't want is homelessness, addiction, loss of family, loss of friends, living on the street, then, drugs and alcohol aren't the way to go. Knowledge, caring, inclusion, understanding that everybody is different and has a unique perspective to bring to a life, and it's not necessarily differences that make you odd, it makes you unique. And if everybody was accepted for who they were, then people wouldn't have to escape through addiction.
There's several services limited within the town of Grimshaw, but Peace River and Grand Prairie would have more services. So mental health is a good resource. They offer therapy and counseling. Also your social worker here at school would be a good resource. Also for people with severe addictions, there's detox available that they can go to as well. Your family doctor is also a good resource to get help with addiction.
When it comes to finding a solution to an addiction, a couple of things are really important. Number one, you need to realize that there is no shortcut or easy answer to break an addiction. When a person works so hard developing an addiction in the first place, it's going to take some concentrated effort to let go of the habit. Number two, secondly, you need to part paths with denial. In other words, you have to admit you have an addiction and in fact admit that you created your own habit. The great thing about that is when you realize you created the addiction, it's also you that can undo it. You must take ownership of it. No one else can make it go away for you. No person and no pill.
I'd like to see youth in Grimshaw get an opportunity to travel, to go and see what's out there so that they know where they want to go, so they have some options. It's such a big world. This is such a small area, right? For them to dash hope before they're in grade 10 it's very depressing for me because I'm not from here. I've seen a lot, done a lot, and there's just so much out there. It seems horrible to throw it all away to get high.
If they're already addicted, I would tell them to please get the help they need. It's a really difficult thing and you can't do it on your own, so you need to get help. And if you're considering starting, I would suggest not. Maybe even if you can attend an NA or an AA meeting ahead of time to realize the struggle that people have in quitting, it might encourage you to not start in the first place.
Well, for those that are contemplating it, like everybody else, I'm going to say don't. I know that's a hard decision to make. As far as those that are using drugs or alcohol, get help. Talk to somebody. I know myself, I had lots of opportunities when I was a kid, but I stayed away from them.
How did you do that?
I avoided peer pressure, and I used sports to keep me occupied. So, and it's a strong willpower. It literally comes down to your personal values.
Continue to support me and keep pointing me in the right direction, because most people, when they're struggling with addiction, they're not going there on the first time, right? You have to, they just need to keep supporting, keep being there, don't walk away.
Pick your friends and carefully, and listen carefully to what they say. Find someone that you admire and go to them for advice.
I'd say seek help. So talk to someone that you trust, whether it's a family member, someone in the community, your teacher. Seek help and use the resources available, mental health, for example. And you want to talk to these people about why you're using drugs, because there's always an underlying issue with an addiction. So that's my main message, is to seek help.
Get help before it's too late. Too late is not that far off when it comes to drugs.
Ask for help. Talk to an adult. Talk to your counselors and keep talking till someone listens. Because the answer isn't using drugs or alcohol. That's just a start of a whole new slew of problems. It only looks like it works because it doesn't in the end.